Good afternoon. Today, out at the fairgrounds, we crossed a milestone. We did our 25,000th test done by the city of Detroit. Doesn't include the hospitals, doesn't include anybody else, but the city of Detroit has now done 25,000 tests between the fairgrounds and between the Abbott 15-minute tests. We are now doing 1,500 tests a day. If you are working anywhere in the city of Detroit, you can get tested. Almost everybody we're testing now does not have symptoms. So you don't have to have symptoms, you don't have a prescription, but we want to get every single person who has to be out of their house and go to work, get them in and get them tested. And so if you're still coming to work in the city of Detroit and your company is not already called up, just call us, we'll get you scheduled, you'll get in the next few days, and we will let you know if you're infectious or you're not. Some interesting numbers now that we've had a chance to do these 25,000 tests. Detroiters, since the beginning of this, 27% of Detroiters have tested positive for COVID-19. 26% of suburbanites have tested positive, and we've done several thousand suburbanites at the fairgrounds at once. 27% positive Detroiters, 26% positive suburbanites. This virus is all through southeastern Michigan. There's no artificial borders. And people in the suburbs should be just as conscious as the residents of Detroit. And I don't normally spend a lot of time giving advice to folks in the suburbs, but I tell you, I was all around the region over the weekend. People in Detroit are pretty diligent about wearing masks. They're taking this very seriously. I see a lot of people out in the suburbs that aren't, and you're deluding yourself if you don't think that you are at risk. For the last week, 10% of everybody we tested positive, and nearly all of them had no symptoms. And we're continuing to see the same evidence over and over. In Wayne, Oakland, and Macomb County, people who don't have symptoms, there's a 10% chance you still have the virus, you're still infectious to your friends, your family, and your neighbors. So wear a mask if you are near anybody else. The testing accomplishment has been remarkable. A lot of people in the country are saying we can't get tests in the city of Detroit. We've got the tests. We just got another shipment of 20,000 test kits. But I want to again thank Quicken, which has 40 people right now taking your phone calls and scheduling the appointments. Dan Gilbert's going to end up donating basically $1 million of staff time running this call center for us. We're deeply appreciative. And of course, Henry Ford DMC and Trinity Health have been contributing their folks out doing the testing. And I'm really pleased to say that Ascension, the St. John's Providence system, has just announced they will be joining us as well. So we will now have 4 systems along with Wayne State who are out there doing the testing at the website. We're going to have even more transportation options announced tomorrow for people who don't have their own transportation. But we are going to be doing more testing, not less. Today we're at 1,500 a day. If we need to, we'll go to 2,000 a day. And we are going to make sure every Detroiter ultimately that needs a test can get one. I'm going to talk about where we always focus, which is the charts and the progress that we're making. Everybody knows the tragedy that we have lived through in this city, and we are now up to 248 deaths in nursing homes, which is a number that's very difficult even to get your mind around. But that has come under control since Denise Fair and the team have gone through them. But here's where we are. You can see each day what's happened and the decline. The state of Michigan's site for counting has been down since 5 o'clock last night. So we don't have updated numbers today. So the numbers I'll give you are through Friday, May 1st. But again, you can see a trend that is not being replicated in other places. 4 weeks ago, 239 of our neighbors died. 3 weeks ago, 258. 2 weeks ago, 259. A week ago, we saw the impact of Detroiters' commitment to social distancing when we went down to 145, and then the last 7 days down to 73. This is being done by Detroiters committed to each other. And as I drove here today, I must have seen 20, 25 people out waiting for buses or on the street, and nearly every one of them had a mask on. That's what is driving this number, and I'm deeply appreciative to the people of this city. The issue that I continue to raise with the healthcare systems, we have to be open to take care of other patients. We're seeing signs of that, and I was really pleased to see the letter Dr. Joan A. Caldoun released in the last 24 hours, which is guidance to the healthcare systems. I would urge every healthcare system to read the letter. It emphasizes that you have broad discretion in getting your patients care, and it does a beautiful job of laying out the details of how it should be done. But it's very clear that it is time to restart the healthcare system in this region, and it is now incumbent on the healthcare, the hospitals and systems themselves to explain to your patients what precautions you're taking. They need your care. They need to be able to feel they can come back with Dr. Caldoun's guidance. You have clear direction as to how to open up our healthcare system again to take care of everybody who really needs it. And so deep appreciation for that. It was the document I think everybody's been waiting for. I want to thank our city employees. This is National Public Service Recognition Week, and I can't imagine a more appropriate time to thank the public servants who have done so much. The police, the fire, the EMTs, the DDOT drivers, and everybody behind the scenes in all of the city departments. Right now, City Council is in the process of adopting a budget. It's not getting a lot of attention. There's a whole lot of folks doing really hard work to get this done. And unlike some of the drama you're seeing in Lansing, you're seeing the mayor and council deal with a $350 million budget deficit professionally, without a lot of acting up, without a lot of rancor, just getting down to work. And city council leadership, particularly Council President Brenda Jones and Budget Chair Janae Ayers, have just set a tone that says we are going to balance this budget. We're not going to play political games. And the conversation has been, how do we make sure that we're operating in the black? So there's no chance we ever see Kevin Orr come back here again. And I'm confident that my partners on City Council are going to get a good budget done in the next 24 hours. It's National Public Service Day for the 200 general service employees who came back to work and the 200 DPW employees who came back to work today, the people cutting the grass, the people repairing the roads. And because we have the strictest medical guidelines, and we made each of them take a COVID-19 test before they come back, we found that 20 of our 200 general service employees who had been at home tested positive. I think not one of them had symptoms. 10 of our 200 DPW employees tested positive. And so we are making it a point that as we bring folks back together in the workplace, that we are going to do everything possible to screen out those who are contagious, make sure they get proper medical care, and also make sure that if you come back to work for the city of Detroit, you're protected. The contractors that are going back to work this week that we talked about last week, the 16 projects with the $110 million, they are all being tested now too. They're finding the same kinds of numbers, and I think everybody is appreciating the fact that because the city has got free testing for your employees, you can safely bring your folks back without them infecting each other at the time they come together. We're seeing great cooperation in the grocery stores. We'll make it formal very shortly, but the grocery stores have been so good we haven't needed to, but they are doing exactly the same thing and making sure that their workers are protected. And interestingly, we are approaching 400 postal workers who have signed up and come through the fairgrounds. And it's unfortunate that somebody did not make sure they got tested earlier, but we are making sure they get tested right now. We have some other things we want to continue to advise the residents of Detroit about, and one is the ongoing issue with people who have lingering property tax bills who are on payment plans. And everybody in this city knows what has happened. You had people who have had bills extending back to 2011, 2012, 2013, were on payment plans. Those assessments in many cases probably were not fair at the time. And when you add on the interest and the penalties, people are staying in their homes, and Treasurer Sabri's done a great job in the payment plans, but because of the interest and penalties, they could never get out from under it. We passed, with the support of Representative Wendell Byrd, the PAYS legislation, which the governor signed into law a few months ago. It seems a lot longer ago. And the first 4,000 plus letters have gone out. And as a reminder, if you own a house in the city of Detroit and you're an individual who makes less than $22,000 a year, or a family of four that makes less than $32,000 a year, it is very likely you're entitled to a break on your property taxes under our poverty exemption ordinance. So if you make less than $22,000 as an individual, you make less than $32,000 as a family of four, you go on the city's website and you can get that break. What the PAYS bill did was said if you fell into that category and you have old bills that have been haunting you for years, you can knock those interests and penalties off, and in many cases, half or two-thirds of your payments can be reduced. And so a week or so ago, Treasurer Sabri sent out more than 4,000 letters to Detroiters who qualified on this, but you've got to actually follow up on that letter, and you can get real savings. And we have a longtime Detroit resident who has been in his house on the east side since the 1980s, who was one of those who got caught up in one of these cycles of payment plans back to 2013, and is now in a position, because he signed up for PAYS, that he's going to be out from under that and be able to own his house without the kind of anxiety that comes with worrying about being behind on your bills. And so I'd like Mr. Derek Kennedy to talk about his story, and I want anybody out there who's got these property tax bills lingering to listen to him. He navigated the system, and he made it work, and it will work for you the same way. So with that, I'll turn it over to Mr. Kennedy.
Good afternoon. I am Derek Kennedy, and in spite of the disparaging times we find ourselves in this May of 2020, considering COVID-19, I do have to say that there are some bright lights yet shining. I've been a very big beneficiary of the bright light shine by the City of Detroit, and particularly the Treasurer's Office, and they partnered with Wayne Metro. I became affiliated with their union about 3 years ago, and as Mr. Mayor did suggest, I did sign up, I enrolled, and I've navigated the system over the course of time. There's yet been a lot of trying situations for me to overcome. A few times I was very despondent to the point of wanting to give up. But I have to say that the support I got in so many different entities from Wayne Metro and from the City of Detroit, I'm able to sit here today and tell you I was sitting on my porch yesterday crying tears like a baby because I was planting flowers in my yard in the home that I've lived in since the 80s, but I was about to lose due to tax foreclosure. But because the help that I got and the diligent support, not just with the finances, I was able to overcome. So I want to tell you, look in the mail, and if you got one of those letters, address it. Go on the website and do whatever you need to do, because I can only tell you, even with the payments that I was making for those years, all that time, I wouldn't have reduced that debt like I did. My debt was well over $11,000, The letter I got stipulated that my current situation indicates a $600 and something debt. I think I can manage that. Thanks, you guys.
So Mr. Kennedy, because he opened the mail, went from an $11,000 property tax bill, delinquent bill, to $600. And it was a situation where it wasn't that his basic taxes he couldn't pay, it was the interest and penalties that had accumulated over the last 6 or 7 years. And that's what this PAYS legislation does. It gets those interests and penalties wiped out so that you can get free and clear once and for all. Treasurer Eric Sabri has done an outstanding job. You can't turn on your TV or look at a billboard without seeing a message from him on how to stay in your house. He just sent out 4,000 more letters to people just like Mr. Kennedy. And we want 4,000 Detroiters to respond to those letters and get the same kind of outcome. And with that, I'll turn it over to Treasurer Sabri.
Thank you, Mr. Mayor. I want to tell you, during this COVID-19 pandemic, we had a special challenge because we had many of our employees on furlough. So we had our call center wasn't operating. So we sent out the 4,600 letters to eligible applicants for the PAYS program. But unlike our original plan, we weren't going to be able to host them individually into the office. So what we did, our IT team did a fantastic job developing a payment plan that applicants can go online and enroll in the Pay-As-You-Stay program. So if you don't go online and enroll in this program, you can still contact us by mail, and we will enroll you in the program. You can also email us at taxinfo@waynecounty.com or go to our website, treasurer.waynecounty.com, and you'll get all the instructions. But the most important thing is that when you get the letter, follow the instructions in the letter, and it's very simple to enroll in the program. Even if you can't pay online, you can go to one of the kiosks and pay and still send your payment plan in, and we'll give you credit and send it back to you. Send us an email address, we'll email your receipt and your payment plan back to you, and you'll be all set. So just like Mr. Kennedy, read the mail, and I want to take a moment too, like the mayor, and thank our county employees who are working diligently through this process, through this COVID-19 pandemic, getting all the work done, making sure that people get paid, making sure that the payment plans are being addressed, and this PAYS program goes on as planned. So far, it's going well. We've got over 299 people enrolled, and we also had another 311 people who had zero balance. Once the calculations were done, they automatically went to zero balance. So we encourage you to follow through and get this payment plan registered, enrolled in the program.
So we're going to come through this COVID-19 thing. And we want to make sure when you do, you come through safe in the security of your home. Denise Fair, it's becoming clear to us that while we've dramatically reduced the COVID-19 spread in this community, it's still primarily being spread in two places: in work sites, which is why we are testing them so heavily, and at senior housing. We've been through the nursing homes, but every single person who dies in the city, I look at the details of that citizen that we lost. And I can tell you the last 10 death reports we've had, 9 of them have been over the age of 70. This is more and more becoming a killer of our elderly. And so Ms. Fair and her team are now working through the assisted living facilities, the adult foster care facilities, and I've asked her before the week's over to have a plan to go through every senior citizen apartment building in this city. If we can stop the spread of COVID-19 in our elderly communities and stop it in our workplaces, we can flat out beat this, and that's what we're trying to do. And with that, I'll turn it over to our Health Director, Denise Fair.
Thank you, Mayor. Let me first say that it's Monday, and I'm so glad to see a lot of the city's contract workers return to work. It's really promising, and so I just want to celebrate them, and we'll definitely be supportive of them returning back to work. Let me give an update on where we are with the nursing home residents and also the long-term care residents. First, the virus, as we know, is spreading really rapidly across the city of Detroit, and it has impacted our nursing homes and long-term care residents, but we have a plan to slow the spread in these communities. So as an update, we've been testing pretty aggressively in the long-term care facilities, and again, long-term care facilities include the adult foster care as well as the group homes. We visited 15 so far, and based upon the results that that have already started to come in, the infection rate is about 10%, which is quite lower than the nursing homes. Again, this is just preliminary, but again, what we're finding is the infection rate is around 10%. We have just about 22 of these facilities left to test, and we're on track to complete the testing probably before May 15, because we are, again, being really aggressive, and we will probably finish by the end of this week. We're also, as the mayor indicated, we're preparing for the next phase of what our congregate testing strategy will look like, and we plan to start targeting the senior home facilities. There's about 10,000 units across the city of Detroit, and so my team and I are planning a strategy, and we'll have that information available towards the end of this week. I do want to stress that the presence of COVID-19 in these facilities, it's not an indicator of poor management. This is a virus that anyone can catch it. No one is immune, but I do want to make sure that you and your loved ones are protected, so please continue to follow safe practices, hand washing, practice social distancing, wear your masks. In fact, I was out running on the Riverwalk Sunday afternoon. I was also on the east side in a couple of the parks, and I did find a lot of people were following the guidelines and they were wearing masks, which is really reassuring. At this time, I typically share the stats for today. As the mayor indicated, the state has reported that their lab system is down, so I don't have information as of today, but I will share with you the numbers as of yesterday, Sunday. Those numbers are 9,388 cases and 1,088 deaths. So we'll have more up-to-date information tomorrow once the state has updated their results. So again, this is real, this is affecting all of us, and we need to continue doing our part. We are doing our part, which is why we see the trend slowing. So thanks to all the Detroiters who are really stepping up and who are keeping us safe. So thank you. And with that, I'll turn it over to the mayor.
Okay, we'll take any questions.
Mayor, we have a question from Melissa Burke from the Detroit News, and they're working on a story that looks at the frontline workers, not just city of Detroit, but across the community. And they say that about 1 in 4 Detroiters is in some form of an essential position, and that they're predominantly minority and low wage. And they want to know if you had some thoughts on or reflections on so many Detroiters being on the front lines of the pandemic, how important their work is, and what the city's been doing to protect them.
Well, there's no question about that, which was the reason that we opened up the fairgrounds to test every single essential worker. We know that many of those essential workers are middle to lower wage type workers who might not have access to a doctor and get into the hospital or the rest of it. And so I would say to every single one of those workers, we will get you a free test. We are getting the results back basically in 48 hours. Have your employer call. But I really do believe at this point there are 2 primary places of risk, coming together at your job site or being in proximity in these senior centers. And making sure that everybody who goes to work is safe is our highest priority. I'll come back to what happened at the Detroit Police Department. 3 weeks ago, we had 600 officers quarantined. It looked like an impossible situation. But by just going through and testing everyone, taking the temperature when the day started, making sure the officers had masks, making sure the cleaning protocols were there, we're down to, one person being quarantined every other day in a department of 2,500. Job sites can be made safe. And if you'll use our testing facilities, follow the recommended protocols that are on the city's website for the city departments, and the private companies apply those. It's not, if you've got to bring people into a restaurant and pack them in, you can't really control the disease, and that's, of course, not allowed right now. But for most other job sites, there is no reason they cannot be running away where the employee's safety is protected.
Okay, Kim Craig from Channel 7 is doing a story today on more of these so-called drifters who have been out with their cars and causing traffic issues, blocking intersections, and she wanted to know what your thoughts are on that and what you would say to these people.
Again, well, I think Chief Craig delivered a message. 2 of them got arrested even before the weekend for use of the internet to arrange one of these. So I direct that to the Detroit Police Department. But not only did the police seize 11 vehicles about a week ago, but they now brought charges, the prosecutor brought charges and arrested people who were organizing the events on Instagram, on Facebook, on direct messages, but arrested them before they even got going. And you're going to see more and more of this. And the Detroit Police Department is very sophisticated, and Chief Craig doesn't have a lot of tolerance for it. So he's been very decisive in dealing with them.
Okay, and follow-up from ML Elric on your comment about the postal workers being tested. Wanted to know who you thought should have initiated that testing before, if it was the federal government?
I was surprised. I look at what we did for the Detroit Police Department, the Detroit Fire Department for DDOT, in recognizing that these individuals were out interacting with the public every day is the essence of their job. And I would have thought that the postal workers should have been watched out for the same way, whether it should have been the Postal Service Administration or the U.S. Health Department, I'm not sure. But all I do know is that the postal workers are deeply valued members of our community, and we're not really going to worry about the fact they work for a different branch of government. We're going to get them in, we're going to get them tested, we're going to make sure they're safe.
Okay, and ML would also like to know if you think that the Fed should reimburse us for the cost of that testing, or if that's part of the FEMA reimbursement.
Yeah, I think it'll be part of the FEMA reimbursement. So the cost has never been an issue for us on the testing. It's just a matter of getting Detroiters. And you think about it from our standpoint. Postal workers are going door to door. These are individuals who potentially, not only are they themselves at risk, but the people they are interacting with are at risk. So in my mind, the postal workers should have been treated like grocery store workers, as people who are interacting with a lot of people, and we need to make sure that they are COVID-19 free.
Okay, and one more question from ML is, given the fact that the city has been so successful in obtaining test kits, he wants to know if anyone from Washington or anywhere else may have reached out for advice on how to ramp up their testing.
Yeah, we've been talking to people all over the country. I'm on U.S. Conference of Mayors. It's amazing. We talked about Dr. Romero at the PRB who did the early test kits. We found a supplier in China who delivered us the first 5,000, and the FDA embargoed it when it came into the warehouse. And I talked to Dr. Hahn, the head of the FDA, and they cleared it. They got the 5,000 released. They were fabulous. They worked great at the lab. So we ordered another 20,000. They got embargoed by the U.S. Department of Agriculture at a Romulus warehouse. But Senator Debbie Stabenow stepped in, and with the federal government's help, they released the 20,000 kits. I won't tell you this is easy. Getting these kits, getting these lab agreements done is a lot of work. I probably spend 50% of my time on the phone working out agreements for testing or PPE or the like. We got Boise Jackson, our procurement department, has just been absolutely outstanding in scouring the country. And we've got great medical advice from Dr. Dunn about what we should be buying. But it's a matter of commitment and resourcefulness. But we recognized early on that the federal government was not going to take the lead in doing this. And rather than complain about it, we just went to work. But we are in good shape. We just ordered another 20,000 kits, so we'll be in good shape for another 6 or 8 weeks. And anytime we start to run short, Dr. Romero sends his team into the lab to make up a batch for us to get us through a day or two. So, you got to, I just look at this. The death rate among African Americans meant this city couldn't tolerate excuses. I had to get the testing done. There's no other way to combat this virus. And so the whole team in the city administration pitched in together, and we've gotten it done, and we're going to keep expanding it.
All Thank you. We have Harold Meeks here today from Tell Us Detroit, who's got a question for you.
Go ahead.
Good afternoon. I have a question for both the mayor and the treasurer. Mr. Mayor, as you bring back on essential workers, how long do you anticipate bringing on other support staff into the city, like in building and safety and the assessor's office, like and offices of that nature?
Yeah, we have a whole spreadsheet that has the starting dates for everybody. But for example, when we brought on all of these contractors doing the road and sewer work for the city, we had to bring in B-seat inspectors, right? Because somebody has to inspect the work. And so that means you have to test the B-seat inspectors, which means you have to have workspace for them where they are separated from their colleagues and somebody's there to take their temperature. And so all of city government is on a spreadsheet. There are jobs, particularly in the IT department, some of the finance departments, you can do them just as well from home as the office. Those folks ought to stay home for the long term. But those who have to come back, literally Dr. Dunn has walked the different offices and has said, you can't bring people in this office, the cubicles are too close together. These are the changes you're going to have to make. So we are not rushing anybody back to work unless we're sure that it is medically safe. But you will see May 18th, we have a number of departments going back to work. June 4th, we have a number of other departments going back to work. I think you're going to see the day in some of the city departments that are a lot of workers in close space in a cube. I think you're going to see the day maybe by July or August where 1 week half the workers work in the office and the other half work from home, and the next week they switch, so that there is 6-foot distance on the work sites, but there's still enough camaraderie of people being in the office with the management. That's going to be, I don't think that's just going to be the city of Detroit. I think you're going to see a lot of companies operating that way until there is a vaccine or a really good antiviral treatment for this disease. And we are assuming that this virus is going to be a part of this community in the fall. It's going to be a part of this community, I believe, in the early part of next year. And so we're thinking through, how do we go to work safely every day for the next several months or the next year, protect our employees? And that's the way we're doing it.
So where could residents find that information out in terms of when departments reopen?
So what's on the website now is the protocols of the safety of the departments coming back. And we will be announcing, I'm sure the next round will be announced this week, but we will be announcing week by week when folks will be coming back. Whether we're ready to lay out the entire thing yet, I don't know. We want to talk to the employees first. And so, for example, I've got a spreadsheet that says we have a group of departments coming back May 18th. Those people are all going through tests today. They're going through the fairgrounds to make sure, because we need to make sure that they're negative before it's their time to come back. And then we got to make sure we have the cleaning protocols in place for the offices. In some cases, we may need to make sure we put up plastic dividers between cubicles. And so when you stage it, it isn't like we say, show up at work May 18th. There's a whole series of medical steps we've got to take. And we don't have the ability to do all the departments at once, so they've been, I think, phased on a pretty reasonable schedule.
All right, thank you. Mr. Treasurer, unfortunately, this new program, Pay and Stay, came on board right around the pandemic start. So how has that affected individuals signing up for the program? And what would you say the success rate to date has been with the new program?
Well, I think that the fact that our IT department did a fantastic job developing a payment plan for online, and it allows people to enroll online instead of having to come into the office and fill out the paperwork there. This has been a big plus for us. Also, people can do it through the mail, and it's working well. So far, like I said, we've had 311 people have a zero balance automatically, and another 299 actually enrolled. And 45% of that group paid it in one lump sum. They paid it off in one lump sum. So it's working well. We just need to get the word out even more for people to respond. We don't want them to wait till the last minute and We want them to respond right away and take advantage of the program. But we're working well with the restrictions that we have in terms of not being able to see the people individually. We're bringing our staff back gradually, and we'll probably go to appointments. And then after that, we'll be able to see some individuals who just have to come in. We'll do it by appointment only.
Okay, and when do you anticipate that process to begin?
In the next 2 weeks, yes.
Thank you both very much.
Thank you.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗、更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。